In this video, we are going to talk about bladder management. It is sometimes referred to as a bladder program and includes the steps you take to remove urine from your bladder. We will define neurogenic bladder, discuss treatment options, how to track your bladder function, and prevention of urinary tract infections, also called UTIs. Neurogenic bladder is when your bladder does not function because of damage to your spinal cord. The brain sends and gets signals from our bladder, and those signals travel through the spinal cord. After a spinal cord injury, you may have difficulty holding in your urine and pushing your urine out of your bladder. If this is not appropriately managed, it can cause bladder damage, kidney damage, and frequent bladder infections called UTIs. This can impact your quality of life if a program is not developed to help you manage these symptoms. When deciding on how to improve your quality of life, increase your bladder control, and decrease your risk of UTIs through possible treatment options, you will be working with your healthcare team. Based on your injury, your treatment might include using a bedside commode or a toilet at regular times during the day and night, not drinking anything 2 to 4 hours before bed, and emptying your bladder before bed. Exercises to improve your pelvic muscle tone, something called intermittent catheterization, which is also called self-catheterization or straight catheterization. This is where a tube is put into the bladder to drain urine, and once the bladder is empty, then the tube is removed. If you would like step-by-step directions on how to perform this, then please see the additional video that we've created specifically for self-catheterization. There are also various medications that might help to relax the bladder muscles and prevent spasming as well. Another option is to place something called a Foley catheter. This is an example of a Foley catheter on someone with male genitalia. As you can see, the blue tube goes up through the urethra and then into the bladder. It'll then drain into what we call a collection bag. This bag is at the end of a tube so that it can collect the urine. A Foley catheter is called indwelling and can be left in for 1 month. Another option is pictured here, which is called a suprapubic tube. This is done by making a hole into the bladder in the abdominal area through surgical intervention. The catheter or tube can then be directly inserted into the hole to empty the bladder. This is a small surgery that makes a tunnel into the bladder right below your belly button, and the catheter is then passed into that space where it will continually drain the urine. So as you can see here, the catheter is placed directly into the bladder and does not travel up through the urethra like the Foley catheter. And using any additional products such as briefs or pads can be beneficial to just absorb any extra urine that might be around your catheter site. To help with choosing the best treatment for you, it's important to keep a record of your bladder activity. Above is just one example of what we call a bladder diary, but you're free to look through many different resources and see what kind of documentation works best for you. As you can see above, this just helps to keep track of how much liquid you're drinking, what time you're voiding, how much is voided, and those sorts of things. And that can help your medical team to decide if the bladder program you're currently on is working as best as it can for you. Moving on to UTIs, this is what happens when germs or bacteria grow in the urinary tract. People who perform intermittent straight catheterization or have catheters are at a higher risk of a UTI. Some other UTI causes can be your personal hygiene, how you wash or wipe after going to the bathroom, irritation caused by sexual intercourse, difficulty passing urine, wearing tight clothing that traps moisture in, a weakened immune system, kidney stones, and just using catheters in general. Some signs of a UTI include burning with urination, having to urinate often or increased frequency, lower abdominal pain, back pain, fever and chills, nausea and vomiting, or cloudy or smelly urine. There are several different ways in which you might help treat or prevent a UTI. You will likely be prescribed a course of antibiotics. Make sure that you're taking the full course of the medicine because your infection may not be cured if you stop early, even if you feel like you're not experiencing symptoms anymore. Also, try to drink at least 8-ounce glasses of fluid daily. Avoid caffeine, this can make your symptoms worse. Also, keep your genital area clean. Don't scrub too hard or use any harsh soaps with bathing. Empty your bladder when needed and empty it fully. Something else that can help is urinating before you go to sleep. With sexual intercourse, be sure to wash your genital area before and after sex. During sex, use a condom to avoid any kinds of sexually transmitted diseases, and urinate after sex to flush away any bacteria that might be present. Some specific tips for women is to wipe from front to back after using the toilet, shower instead of taking a bath, and don't wear tight pants or nylon underwear that can trap moisture and make bacteria easy to grow. Wear cotton underwear instead. And for anyone who uses a catheter, make sure that you wash your hands with soap and water or use hand sanitizer before and after touching your catheter. It's best to use single-use catheters. However, if you're reusing a catheter, be sure to clean it after each use and keep it in a clean, dry area. Keep the tubing free of twists to allow the urine to flow and not back up while using. As I mentioned earlier, if you're interested in learning the steps of intermittent straight catheterization, then be sure to view the additional video. If you have any questions or concerns about your bladder management, then be sure to reach out to your healthcare team.